Hello, my name is Dr. Nishant Singh. I'm a consultant physician and diabetologist in Noida. So today we'll be discussing about understanding hypertension. So this is our discussion basically how high blood pressure is causing the ill effects on the body and what is the how to prevent it. Generally, everyone would like to have a healthy or normal blood pressure, but what exactly does it mean? Basically, each time when the heart beats, it pumps a blood into the blood vessels. So this creates a pressure against the walls of the blood vessels. This is called as the blood pressure basically. Normally in healthy person, it rises and falls throughout the day. But when the blood pressure remains high for long time, like for few hours, even for few days, if it is regularly very high, then it can lead to serious health complications like chronic kidney disease. In general, persistent increase in blood pressure when it is higher than normal, this is called as hypertension basically. So high blood pressure usually develops over a period of time. It is not that you are not having any BP today and tomorrow you cannot be hypertensive. You can be hypertensive still. So normally it happens because of a unhealthy lifestyle, stagnant lifestyle, basically sitting for long hours and not doing any exercises, not having any regular physical routine of physical activity, even obesity, smoking and alcohol consumption, and the daily stress can lead to hypertension. It can also be, there is another risk for this developing hypertension, that is genetically linked. So if your parents are hypertensive, then this is more likely that you are also likely to develop hypertension in future. As the people age, basically when they get older, the arteries get stiffen up and they have become narrow and there is excess body fat percentage. So this leads to more chances of getting hypertension as the age advances. Then if there is a family history of blood pressure, as I told you, one or more close family members like brothers, sisters or even parents are hypertensive, then this increases the chance of you also having blood pressure. Excess salt intake is also very well known factor to raise the blood pressure. Not eating enough foods with potassium can also increase your blood pressure and risk of stroke and chronic kidney disease. So eating processed foods like daily, whatever is available in the market very easily in the packet forms like chips and everything, that increases the body fats gradually, and this can make your heart work harder to push the blood through the body fat, because the body fat is there, it compresses the vessels and this causes the blood pressure. So on the other side, it is causing obesity also, and there is lack of physical activity which precipitates the factors further, and this leads to hypertension. Another one is stress basically. So if reacting to stress is in an unhealthy ways, like if you are not able to escape the stress and you are coping it and you are becoming angry inside and you are not managing it effectively, then it can also increase the blood pressure. So moving on, basically hypertension does not have any obvious signs and symptoms. It can be asymptomatically totally. That is why it is often called as a silent killer, and it is the number one cause of deaths worldwide. It puts people at risk of several diseases, from cardiovascular problem to kidney failure, even the brain stroke, and even eye damages can occur because of this, and even the patient can become blind sometimes suddenly. Hence, early and accurate diagnosis is very important in management of hypertension. Measuring the blood pressure is the only way to know whether the person is having high blood pressure or not. So generally when the symptoms do occur, they include that in the morning the patient will have a heavy head, tiredness. There can be visual changes like blurring of vision, buzzing in the ears, some sounds like ting ting sounds in the ears, fatigue, nausea, vomiting. So if a person is experiencing some of these symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can be very easily diagnosed. It is usually measured with an instrument called as sphygmomanometer that you can commonly see in the clinics. It is a mercury instrument. A blood pressure is recorded in two numbers. There is systolic blood pressure and diastolic blood pressure. Now, what does systolic and diastolic means? In a healthy, normal blood pressure, there should be like a value of 120 by 80. So, it can also be read as 120 over 80. So, when the upper number is, what is the upper number, what is the lower number, what is 120 and what is 80. So upper number like 120, I told you, it indicates the systolic blood pressure, which means the pressure in the blood vessels when the heart contracts. Whereas a lower number indicates the diastolic blood pressure, means the pressure in the blood vessel when your heart is relaxed. So in between the beats when the heart is relaxing, that is called as the diastolic blood pressure. So blood pressure level, if persistent blood pressure, if you are measuring daily consecutively 2 to 3 days, if it is coming more than 140/90, then the person is said to have hypertension. And if the person have high BP levels higher than this, then he or she might be at a risk of developing heart diseases, even stroke and kidney failures over the long term. So this risk can be prevented and reduced by taking steps towards a healthier lifestyle, such as you should do regular exercise, you should maintain a healthy diet pattern. If you are a smoker, you should quit smoking and reduce your alcohol intake. Regular blood pressure monitoring should be done. Like once in a while, if you are getting a readings of 140/90, then regularly you should check it every month. Stress management by doing yoga, meditation should be there, and adherence to medicines is very important with the blood pressure. You should not stop the blood pressure medicine suddenly. If blood pressure is successfully controlled with such lifestyle modification, then you can avoid medicines. But any delay in the medicine intake or reduction suddenly by yourself or titration of the dose yourself, it can lead to worse kind of symptoms also. It can lead to kidney failures also. So if we talk about whatever I've told you about the exercise, healthy diet, quit smoking, regular blood pressure, let's talk about this in detail one by one. So first of all, I'll tell you about the regular exercise of physical activity. Exercise, it is a very good drug-free approach for lowering the blood pressure. Regular activity makes person's heart stronger. If one have a strong and healthy heart, it can pump more blood and less effort. So if the heart has to work less to pump, the force of the blood vessels will decrease, and this will in fact reflect in your readings also by lowering lower value of the blood pressure. So in other case, as we all are aware that the age and weight gain are the two major risk factors for the BP. So if blood pressure is at a desirable level like less than 120/80, then exercise can help prevent it from rising as you age, if you exercise well and daily. Regular exercise also help you to maintain the weight, which in my opinion is a very important thing to control the blood pressure. And one should at least aim for 30 minutes of aerobic activity most of the days in a week. High BP level can be reduced by doing regular structure exercises such as brisk walking, jogging, or swimming also. So you can develop a hobby of swimming, jogging, bicycling, cycling, whatever you like. And this in the long run will be a preventive measure from your side for developing a hypertension. So second is the healthy diet. Diet also plays an important role in controlling blood pressure. A diet with high intake of vegetables, fruits and whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through dietary intervention, one can opt for dietary patterns such as DASH diet or Mediterranean diet, and eating less saturated fat or total fat, getting plenty of potassium, limiting the amount of sodium in the diet, and limiting the alcohol consumption. Now, I told you about DASH diet. DASH is a diet which is rich in the whole grains, fruits and vegetables, and low fat from the dairy products, and very low on saturated fat and cholesterol. So this type of diet can lower your blood pressure by 11 millimeter if you are hypertensive. So like if you are having a 140/90, if you go for DASH diet and regular activity, you can become a normotensive patient without any need for medicines. Then reduction in sodium is very important thing. We know that a small reduction in sodium can lead to very much improvement of 5 to 6 millimeter immediately in the blood pressure. So to decrease the sodium in your diet, what should you do? You should always, when you are buying from the shop or a supermarket, you should read the food labels. You should avoid the products which are having high sodium content, and you should choose the low sodium alternatives for such foods. And you should eat fewer processed foods. Only a small amount of sodium occurs naturally in the food, so most sodium is added during the processing of the foods. So you should eat most natural products. Don't add salt. One level or teaspoon of the salt is around 2300 milligram of sodium. So avoiding adding the salt to the food can increase the chances of having blood pressure. Even Indian culture of having chutneys and achar is a significant amount that contributes to your blood pressure. Smoking, we know smoking kills. Even the government is writing it on the paper that smoking kills, and smoking is the number one cause for increasing the blood pressure overall. So stop smoking helps you. If you stop the smoking and if you quit smoking, you can effectively reduce your risk of heart diseases also, stroke also, and improve your overall health and blood pressure. Regular blood pressure monitoring is very important. Basically, if once in a while in your office you are getting checked for the BP and you have found that there is a borderline type of blood pressure, so most often I advise the patient to do a self-monitoring of the BP at home. Self-monitoring helps person to measure BP at different times throughout the day and over a longer period of time. It also assists the doctor to get more complete picture of the person's blood pressure readings at different times, as some patients may develop high BP at the time of night, evening time, and some patients may have blood pressure high in the morning. So it further helps us to predict the cardiovascular morbidity and the mortality rate than single routine blood pressure measure that can occur during the clinical visit. Now, stress management is very important. You should relax, manage stress, can improve emotional and physical health and lower high blood pressure. Stress management techniques include exercising, listening to music, focusing something calm or peaceful, and meditating regularly. Adherence of medicine is very important, as I told you. A medicine is recommended by the doctor to lower your blood pressure below the level of 140/90. And if you are skipping your medicine, or if you are not taking your medicine regularly, then you are inviting serious morbidity and complications for yourself. I would like you to suggest that there is nothing more precious than having a fit and a healthy life. Adapting healthy lifestyle can help us to enjoy a long and a healthy life. And high blood pressure can be prevented as well as controlled in many ways that I told you. Keeping blood pressure in a normal range is very important to prevent the cardiovascular complications and even the stroke. It is very much possible to maintain normal blood pressure levels with a regular monitoring and preventive care. Thank you.